Hello everyone, I'm Afaf Kanja and welcome to South News Roundtable. Our topic is on non-communicable diseases and particularly on breast and cervical cancers in the developing world. Our special panel guests here today for our roundtable, I will start with, on my right, the First Lady of Malawi, Madame Calista Mutharika. First Lady of Malawi is the incoming Vice Chairperson of Forum for African First Ladies Against Breast and Cervical Cancer. She's an advocate of expanding cancer treatment and prevention methods to rural parts of Africa. She's also in charge of the Safe Motherhood Foundation. The First Ladies Foundation seeks to promote the advancement of women and vulnerable populations in all sectors of our rapidly changing and developing society. Welcome to South News. To my immediate left, the permanent representative of Trinidad and Tobago, Rodney Charles. Ambassador Rodney Charles is a former communications director of the United Nations Congress. He was also the senior policy advisor to the president of the COSTAT, Emmanuel Gonzalez. In 2007, he served as the marketing and public relations consultant to the leading political parties in St. Lucia. Dr. Karen Seeley, to my far left, public health specialist with the Pan-American Organization for over 20 years and has served in various senior positions in and outside of the UN family. Dr. Karen Seeley was the first regional director for the Caribbean in UNAIDS and heads the regional support team which serves the member states of the Caribbean community, CARICOM, and all other Spanish, French, and Dutch countries and territories in the Caribbean. Welcome to South News. Princess Nikki Onyeri on my far right, Executive Princess Nikki of the Cancer Trust, is a Nigerian advocate for breast cancer and the empowerment of women in what she recognizes as a mainly male-dominated culture in Nigeria. She serves as Chief Executive of the Princess Nikki Cancer Trust, which ranks as the foremost non-governmental organization on cancer in Nigeria with special focus on breast cancer. She is finalizing her plans for a run for the Abuja Municipal Council area and Buhari of the Federal Capital Territory of Nigeria. Welcome to South News and welcome panelists. Thank you for being here. The numbers that we're hearing about when it comes to cervical and breast cancer are on the rise, not only in the developing world, but also throughout the world. But they're impacting the developing world in a very severe way, and that's what we're here to talk about today. As the ambassador of Malawi pointed out yesterday in the side event for discussions on the matter, saying that these statistics, 90% of non-communicable diseases occur in developing countries. This is drastic. And as he pointed out, these statistics are not mere numbers. These are our mothers, our grandmothers, our sisters, our aunts, our daughters. So this really hits home, you know, as we heard yesterday and as we're learning about. So if I can start, Princess, you were misdiagnosed. Now, just the time when you actually were, you know, misdiagnosed and then flown to London to get what you thought would be treatment, what was that like for you?
Cancer in Africa is a death sentence. At the point, which is 1992, 93, I have never ever had the word cancer. And I'm telling you, I have my first degree, I have my master's degree. I've never. So even when the doctor was saying you have breast cancer and 6 months to live, I had no idea what he was talking about because I could have asked questions. So it was something that, you know, you had to grapple with. I had trauma. I think I had depression. For me, it was like, I'm going to die in 6 months. What the hell is that? And but I was blessed in the fact that in my family we're 8. We had a nurse. We have a sister of mine is a nurse. I have a senior brother who is a consultant surgeon. And so the medical people in the family were like, what exactly did he do? This doctor didn't do. I didn't know he wasn't an oncologist. He wasn't a cancer specialist. I was asked to go to this hospital. So in Africa, we assume all doctors know everything. And I didn't see him do mammogram. My brother was asking, did he do mammogram? I was staring at him. Did he do ultrasound? Did he do this? I could recollect none of those were done. And it was like, listen, we need you to go for a second opinion immediately in UK. And if it's confirmed it is, we prefer you getting treatment there. And even when he was telling me 6 months to live, he never even said what stage it is. What exactly is it, stage 1, stage 2? So the point is that I went through whatever breast cancer patient went through. The only issue is that when I got to UK, they finally confirmed that it wasn't breast cancer, that what I had was a benign cyst, and I should check it every time. But to tell you the truth, this is a disease killing women in Africa, and I guess all around the world. It's not just breast cancer for Africa. Cervical cancer now is the #1. Breast cancer is #2. And the important thing is that with awareness, education, with the necessary tools, screening, vaccination for cervical cancer, early treatment, diagnosis, it is very clear that we can live. It is a disease that is preventable, is treatable, is curable, and we can live very good life. So I did not have breast cancer, but I went through what everybody who was diagnosed went through. So when they say survivors, I stand up, I claim that I'm also a survivor. Thank you.
Dr. Sidley, so does this mean that there's a lack in the proper infrastructure, that it's not just maybe a poverty issue, but it's actually a resource issue?
Well, I think there are several factors behind the current situation. First, women do not have the information, which is what I think Princess just, in fact, demonstrated there. And there is a need for resources just for that. Before we start to talk about treatment, we need to be able to educate and inform our women and families, because it's not just the women we have to educate, it's both the women and the families. Then we have to get women to understand, just as Princess said, that it is in fact, these are diseases that can be prevented. And I want to make the link here back to the NCDs, because the NCDs that have been selected are the ones that have common risk factors. If you, in fact, have an adequate and appropriate diet, and you exercise, and you do not smoke, and you do not abuse alcohol, you will reduce the risk for those 4 diseases, including cancers of the breast and cervix. So we have to understand that the cancers fit into that focus that is going to the United Nations have. In terms of the resources, yes, there's need for investment, as my colleague Purnima Mane from UNFPA said yesterday. We have to get governments to see this as investments. We have to get governments to understand that if we are serious about seeing women as not only being vulnerable, which is what we tend to put into that, put them into women and girls as vulnerable, but as really agents of change of development. I mean, we can just begin. Women are the ones that educate their families. They're the ones that cook the meals for their families. They're the ones themselves that have to care for the families. So their health is critical to the development of countries.
Absolutely. Speaking of development of countries, Madame Mutharika, let me ask you, in the research that we're seeing and in the statistics that we're learning about, is there a link with poverty and these diseases? And we talked about education. Tell us more about that.
Yes, there's definitely a link between these non-communicable diseases, breast cancer and cervical cancer, and education. Because when people are not educated, they have no information. Even when they have leaflets going around in their communities, because they can't read, they lack the information. And because there's so much poverty, they have no radios. So even when messages are going through the radios, but because they can't afford batteries for the radios and they can't buy the radio itself, they find themselves that they have no information at all. So they don't know anything about what is happening, apart from what their grandparents and their parents are telling them. So education is very important in this case if we have to deal with the fight against these non-communicable diseases, breast cancer and cervical cancer. And as it was said yesterday, if we don't address these women's health issues, then we are obviously derailing development. Because when there are so many sicknesses, You find people don't work, they don't produce food, they can't look after the children, they can't even go to school. So development is derailed because of lack of education, lack of poverty, and
So it's a
on.
constant cycle.
It is a cycle, yes, yes.
Ambassador Charles, from a male perspective and from a leader, a diplomatic leader of your country and these organizations, we have learned at the United Nations and elsewhere that it's not just about educating the women, it's about educating the men as well and empowering the men on what they need to know to help these women and at a young age, right? What is your perspective on that?
Unfortunately, in developing countries, we tend to be a male-dominated society. It's designed for people like myself. We are empowered. We have the final say in how much money goes in the home, what foods we eat, and whatnot. And little children look up to the fathers. To the extent that fathers could empower their wives, and this is part of the education process, to be co-equal partners in this process of child rearing, in this process of development, then we will not be achieving our optimum development. So significantly, this is why our Prime Minister, Mrs. Kamala Persad-Bissessar, is promoting a forum, a high-level colloquium on the margins of the 66th UN General Assembly in September. Women leaders as agents of change, because she sees, right now we have leaders in Australia, Chile, Bangladesh, and Trinidad and Tobago and some other countries. And if these women can get together and provide an example of what women can do, of what women can achieve, then I think it could act as a mentor for young women globally to see the possibilities.
And we've also learned, of course, and Princess, just as a testimony to that, it's really early diagnosis and correct early diagnosis in her case, so it's truly preventable. So Dr. Seeley, I have to ask you, if it's preventable, if the deaths caused from these diseases is preventable, why aren't we learning from best case practices from other countries who have really controlled the situation?
Well, I think that's why the high-level meeting, that's the focus was important, because we know that there are best practices in many of the developed countries. Many of these countries have brought their incidence of prevalence of cancer of the cervix and cancer of the breast and mortality from these diseases way down. Now, it's easier in terms of the prevention, in terms of the screening, in terms of secondary prevention for cancer of the cervix. We now have, as a result of the research, not only the pap smear, but a range of approaches that we can use, in fact, to detect whether there are in what we call precancerous cells. And if we can treat those precancerous cells, in fact, you prevent the cancer from forming. And we also have a series of approaches that we can use in terms of the treatment for very low resource settings, not the high-tech metropolitan centers with no, there are many approaches that are being used. And I think what the challenge of the countries in September is going to be for calling for the investment in scaling up the use of those technologies in all of the developing countries.
Can I indicate that as far back as 2001, CARICOM found a relationship between high incidence of NCDs and poverty. And we tried to deal with it at the national and regional level. And we found that we could not, because of the fact that the problem is so multifaceted. If there's a prevention component, we are talking about what our citizens eat. And we are now into the fast foods global dynamic that is changing our eating habits. We also have a sedentary pattern, looking at the computers and the televisions and whatnot. We also find agriculture. We stop or undervaluing the fruits that we produce in favor of North American Oreos and those sorts of things. So recognizing that it is an international multilateral problem, we decided at CARICOM to champion this approach to bringing it on the agenda of the United Nations.
Ambassador, how do you motivate governments who lack resources to even feed themselves, as we were talking about earlier with the First Lady, in general for a lot of these developing countries, especially the least developed countries? How do you encourage them? How do you motivate them to deal with what for them is maybe a long-term possible issue when they can't even feed their kids at home?
Actually, it's not long-term. To the extent that women have to divert attention away from advancing themselves in terms of doing what they're supposed to do with the family to treat provide care for those who are affected by these diseases. By the fact that our developmental index, for example, how long we live, well, 70 years, it could reduce to 65, depending if we do not treat with the diseases. So you find that it is a question of educating the country and the leaders, and we expect globally that will happen when leaders come to the United Nations and they hear this thing being addressed. Then they will be sensitized to the problem and the cost it pays to development, and therefore they will treat. In addition, these developing countries, least developed countries, when they access loans from the United Nations agencies, tend to think in terms of infrastructure development, roads and bridges and those sorts of things, not knowing that there is a developmental component to the treatment of these diseases. And in fact, the UNDP, Ms. Helen Clark, who is the person, the administrator, she has agreed to place it on the agenda for development. So the aid we'll now see, aid being directed to these kinds of diseases, non-communicable.
You raise a really good point that it's not long-term, and I will go back to Princess on that. It targets women, or these diseases, these non-communicable diseases, specifically breast, and now, of course, moreover, cervical cancer, at their most productive years, right? So this regression, you know, when you're becoming a mother, when you're at your prime in your career, so on and so forth, it's all halted. And as Ms. Clover shared with us yesterday, the breast cancer survivor shared with us yesterday, it depleted everything she had, financially, emotionally, and it was her strength and her faith and her family that kept her going. But please.
If I could come in here at this point, Ambassador just referred to the fact that the Prime Minister of Trinidad sees the role for women leaders. And you asked me about best practice, and I think we have right here among us, in fact, a very best practice. And just to bring a little of my experience from UNAIDS, and just to update you to know, in fact, I have now returned to the Pan American Health Organization, and I'm working in the office of WHO at the UN. And in HIV, there was a serious movement, in fact, to bring women leaders to become advocates for what needed to be done for HIV, both at country level and at regional level. And I think already at the First Ladies Forum of Africa have really got off, you know, at a quick start, as it were, and will have a lot to share with other women in other regions. So I think it's important that we...
Maybe I take from there. Like I said, when I had my misdiagnosis, this word, you cannot say cancer anywhere. I remember when I came back from UK and I was thinking of floating the Princess Nikki Breast Cancer Foundation. Then on television, on radio, when I'm talking, I'm saying I had, you know, misdiagnosis on this left breast. People kept calling, and I'm not telling you highly placed human beings calling to say that, why are you touching your breast? Why are you saying breast cancer? By saying it, you are inviting cancer to yourself, you know, and so we needed to do a lot of awareness campaign. That's where the media, we have to be partners, and what we're doing today is critical. Without the media in Nigeria and Africa, we couldn't have done it. They partnered with us, so each step of the way they were doing campaigns with us, especially in the local languages, is very critical. Most of our people, it's not just the women, most of our people in Africa and around the world are uneducated. So we must learn to put education in the language they can understand, so that they can have buy-in. And as people began to understand that this can occur to them. I remember when I wrote to a First Lady, as we were thinking, because we ran the campaign for it, the foundation is now 16 years. We ran it for 10 years. We were making some sense, but we realized that if we bring in high-profile women, and who are these? We think of our mothers, the First Ladies, that these are women who, once they stand up in their countries and they take up an issue, the whole country buys into that. And imagine who can convince the president more than the first lady? You know?
So let's turn to the First Lady on this. And you reiterated a very valid point that reports are showing, that in developing countries, as compared to developed countries, women are seeing breast and cervical cancer 10 to 15 years prior, right? What are some of the age ranges you're seeing in Malawi, for example?
Well, not much feedback at the moment because we're just starting, to deal with these diseases. If we had started earlier, then perhaps I would have said, "Oh, there's progress and so on." But
No, I mean in terms of the ages, what are you seeing? Are women going? Are they going into the resources that are available currently in Malawi? Are they being diagnosed? Is there any relevant information to this matter?
You know what I can say. I think it would be right for me to say that. It is non-existent because the resources are not there.
And here
The screening centers are not really there. I think I think there's just one at the moment, and people have to pay, and people don't have the knowledge, the information, as we have already said. So we are just starting. I can say that
at the policy level, you're asking again what can motivate leaders.
Yes, right.
The experience from the CARICOM region, when the CARICOM summit was held, I think one of the things that we learned from that was that we need to provide evidence to leaders. Right. And so we need to help NGOs to collect the data, to analyze the data, to advocate. You need evidence, you need information for advocacy.
But
when we saw the data, we began to get to understand the complexity of the problem and the depth of the problem that we face. For example, 60% from NCDs die every year. And the data tells us that it is likely to grow by 17% in the next 10 years. So think of that. We have oil and natural gas. I'm speaking of Trinidad specifically. But our health service is overwhelmed right now with trying to treat with our diseases at hand. In addition, and I think all of us experience that where our healthcare providers tend to migrate. You told me about your brothers and the access to North London, because they're attracted to the first world. So you have a under-resourced financially. You have people who are being the best and brightest are attracted outside, and we have to treat with a disease that is growing as we speak. And therefore, when you speak about the immediacy of the problem, the long-term nature of the problem, it is there with us right now. And if we do not deal with it, then...
I think I'll chip in. I think also it is very important what will happen here in September. The focus that is being brought to NCDs. To tell you for Africa, what we have always been battling with is the global attention that focused on HIV, AIDS, TB, malaria. And for us in Africa, that became that this is the disease that you have. So it took an uphill task for us who are living in the continent. And that's what I tell people. I say that there must be ownership from continents, from in-countries. They have to spearhead issues, given their cultural, their environmental, and things that they're used to. And now you find that we said, no, we live in this continent. Our people, we're seeing, the First Lady can attest, some of her friends have died from either breast, cervical cancer. We witness this, our mothers, our grandmothers. Sometimes it's not called cancer. We have, yes, there's no name. In some places you don't even have, they call it the big disease. Yeah, so people are dying. We are seeing it. So we started saying that as you are focusing attention on TB, malaria, and HIV/AIDS, please, our continent, we are dying of cancer. In particular, the women, especially the First Lady, said that we have to start from what we know, the known to the unknown. And that's why they said we will champion breast and cervical cancer, because this is our own disease. And I'm comfortable to talk about it. And I know even as they talk to their husbands, some of the presidents have also said, you have to talk about our own issue also, which, yeah, you know, prostate cancer, that we will support you if you don't do our own. So the point I'm saying is that as long as people don't have information, don't have education, they can do much in terms of putting the resources there, putting infrastructure there, and so on. I can tell you now, the leadership that has been provided by the Forum of African First Ladies against breast and cervical cancer is now a challenge to the world, because now they are realizing that Africa has taken the lead, spearheaded this issue. The first ladies are traveling all over the world to tell the world that this issue we are championing, we need your support. Please join us. Our women are dying, and we need every hand on deck to be able.
There are so many facets and so many issues revolving around these diseases, but to wrap up, I would like to hear from each one of my very special guests today. We hear about a comprehensive plan, right? A global comprehensive plan. I'd like to know if you agree with this, if this is reasonable, if it's practical, and if it can really happen from action on the ground.
We hope that at the coming out of the meeting, that the high-level meeting, which will be held in September 19th and 20th, that there will be an action-oriented, focused outputs document that could indicate what the issue, what are the challenges, how do we treat with it, and how can we integrate non-NGOs, how can we parastatal organizations, at national organizations, multinational organizations, regional organizations, to focus on this problem. It is our hope that the high level, the presidents and the prime ministers who attend this meeting will go back after they discuss and they analyze and realize the significance and importance of NCDs and cervical cancer and breast cancer, important components of that the action will move from the multinational level to the national level. And just one last point, the developed countries have significant high incidence of the problem, but they can treat with it. Mm-hmm. So when we bring it up, they do not see it as an issue. They can deal, and therefore but we have, if we don't bring it at the global level or at the multinational level, then multinational agencies and institutes will not deal with it. And it is our hope at the end of this that it will now become a priority globally.
Dr. Sear, do you agree?
I absolutely agree. It's only from a summit like this, or a high-level meeting, like this, will countries of the world come together to in fact agree on 3 or 4 basic strategies that they will together collectively work on. What's the advantage of this? This helps, especially when countries now individually seek assistance or support from the international development agencies. They understand that this has been agreed to at the highest level. This is not one country that's split. This has been agreed to, and then in fact, it's going to force the development agencies to put NCDs on their agenda. Part of the problem right now, it's not on their agenda, as they say, not only in Africa, but globally. I mean, when you look at the graphs in terms of the priority, the burden of NCDs and how much those agencies are putting to it, it is not there. The other thing is that there are certain building blocks, as it were, have already been developed by the World Health Organization. The countries of the world have agreed on the strategies for diet and physical activity. They have agreed on the strategies as to how to, in fact, limit let me put it in a positive way, how to promote appropriate marketing of food to children. They've agreed on, so there are about 8 strategies that have been developed globally that once the overarching strategies have been agreed to, such as, I think the countries are going to need to, we have to address the risk factors. And with respect to risk factors, with smoking, we're already on the way. We have a convention for that. But countries have, in fact, signed, but they've ratified, they've not implemented the convention.
That's key.
Now, with this, we are going to be able to monitor the progress and feed it back to the UN. And I think that's when countries really take attention, take notice, and put their resources and commitment against a development problem.
Princess, what's your feedback?
What I could say is that in working on breast and cervical cancer, my experience, not just in Nigeria, but also in Africa, was that in the ministries of health, we as an NGOs, civil society, but there's a limit to what civil society can do. And what I tell civil society people is that there is no country you can work alone. You must learn to work with governments, because government is government. And you must be able, it's not easy to break into government, but you have to keep pushing. The challenge there is that the government, you don't blame them. They don't trust civil society. Some of the civil society, they're not true to what they claim they are. So you must be able to prove yourself, knock the door, and push. And once you're able to open that door, get to the ministries of health and explain the issues. I know that, for instance, when we started out in Nigeria, where cancer features in the health ministry was nothing. It's just under non-communicable disease, and it is way down. It was the last mentioned. And when we were saying cancer, the minister was saying, the document I have is not featuring prominently on this. That's why this link with the high-level summit in September is very critical. If the attention going forward from that meeting is focused on these 4 diseases, cardiovascular, diabetes, cancers, and so on, whether you like it or not, once decisions have been taken at the level of presidents, immediately it comes down to countries. The ministers, they don't question it because it's a working document. You see immediately the ministers will put priority on it. Yes, there is no question about it. And that is what brings education. That is what brings resources. That is what even brings international support for this. Because as at now, at least in Africa that I'm sure of, you cannot get any international agency. There is nothing that features there on NCD, cancer in particular. When you go to them for that you want to do this or that, they will tell you that we don't have funding for it because there is no money coming from anywhere. So the high-level meeting is critical. And once that decision is taken down, that it will go to the regions, it will go to countries, it will go to the grassroots, and we will be home and dry.
First Lady Mutharika, your comments.
Yes, indeed. I want to agree with what Princess Nikki is saying, that as for us, as a Forum of African First Ladies, what we want to see is to see that the UN high-level meeting in September is successful. And by saying successful, we are meaning that we should see breast cancer, cervical cancer, and other non-communicable diseases figuring prominently in their outcomes document so that governments can begin to take action and stop now the talking, because we are fed up with the talking. We want now action. And it is only if the UN high-level meeting comes out with these diseases for the governments to take action, that these governments now begin to act. So we are waiting for them to see that this meeting in September is successful.
Thank you so much for your input. Thank you so much.
See the forcefulness of the woman.
Yes, yes.
There's at your change.
But your input is impeccable and much needed. Thank you so much for being here and for your insight and for your knowledge and for your background and for your leadership. Thank you for joining us here on South News Roundtable. I'm Afaf Kanja. We'll see you soon.